I'm a skin cancer surgeon and it's Skin Cancer Awareness Month, so come walk a mile in my shoes. And to be very clear, this is a graphic mile.
This is a typical case that I would perform Mohs micrographic surgery on. This is a basal cell carcinoma. So we numbed up the area and I removed it with a scalpel. I made a map of the piece that I removed and added some ink so I could see it under the microscope. My histotechs then freeze, slice, and stain the tissue so I can look at it and see exactly if there's skin cancer or not. In this case there was, and we had to repeat that process 3 more times. And this is what she was left with. I stitched up the area using an advancement flap and she went home. Fast forward 6 weeks and she's looking pretty good. This is another skin cancer I recently removed that went all the way through the ear. I actually took some skin from the cheek, left it attached near the ear, and used that skin to rebuild a new bottom portion of his earlobe. That tunnel of skin will last for 3 weeks, and then I remove it, leaving him a brand new ear with skin from his cheek. Of course, not every skin cancer is as complicated. Here's just a small one on the temple that I could stitch up with a straight line that's virtually undetectable a few weeks later.